Hi, I'm Dr. Keith Volstad.
And I'm Laura McLeod Volstad of Volstad Chiropractic and Integrated Wellness. We're located at 275 Tony Penna Drive, Suite 12, right here in Jupiter. And our telephone number is 746-4242. We'd like to welcome you to this week's edition of the Chiropractic Corner, a weekly show spotlighting the chiropractic profession and what doctors of chiropractic do to improve their patients' health. In this program, Dr. Volstad and I plan to cover topics that pertain to your health from a complementary and alternative medicine point of view. These topics will include spinal injury issues like neck pain, low back pain, bulging discs, pinched nerves, and sports injuries, lifestyle medicine, dietary and nutritional advice, nutraceuticals, and supplementation, just to name a few. We'd like to encourage you to email us about topics that you'd like to hear discussed on this program. You can do that by emailing us at imchiro1, the number 1, at gmail.com. That's M as in Mary, CHIRO, the number 1, at gmail.com. If you remember, in the last couple of shows, we had a discussion about functional medicine as we've talked about what functional medicine is and how it differs from conventional Western medicine, as well as some of the considerations functional medicine practitioners go through when evaluating a patient. Doc, would you give us a brief synopsis of what functional medicine is and how it differs from conventional Western medicine?
I sure will.
Thank you.
Here's a quick review. Functional medicine, also known as lifestyle medicine, engages both the patient and the physician in a partnership, a therapeutic partnership. Instead of the doctor being the primary motivator in a patient's recovery, always the doctor's the one that always wants to push the patient and is kind of in charge of the therapeutic process. Functional medicine promotes more of a team effort. In this case, the patient takes on quite a bit of responsibility for their own recovery. Then the doctor just provides the therapeutic input, that is, he provides the things that the patient can do to help themselves.
I see.
Functional medicine also changes the focus from a disease-centered orientation to a patient-centered orientation. And by shifting this traditional disease-centered focus of medical practice to a more patient-centered approach, functional medicine addresses the whole person, not just a set of symptoms, and that's the difference between disease orientation and patient-centered orientation.
Okay.
Functional medicine physicians will spend a lot of time with the patients, listening to their stories, learning about their lives, looking at the interaction between their genetic, environmental, and lifestyle factors, and that these things then can influence their long-term health and how the interaction of them can create complex chronic disease states. Then it puts together an individual treatment plan to address the individuality or uniqueness of that patient's condition. In this way, functional medicine supports the unique expression of the individual's health and vitality. It is an evolutionary change in the practice of healthcare, and that change better addresses the healthcare needs of patients in this 21st century.
And probably their expectation as well.
I would think so, right. I think the patient feels a little bit empowered, like they're not helpless and at the beck and call of the healthcare provider, but now has some responsibility in dealing with their own healthcare issue.
Okay, thanks, Doc. So this week we wanted to continue that discussion about the functional medicine approach to restoring your health and your vitality. And last week we talked about hypothyroidism. Doc, this week can we talk about another specific problem or condition some of our listeners may be experiencing? Continue to give them an idea of how functional medicine or AKA lifestyle medicine would approach the condition.
Sure. I thought this week we might talk about cardiovascular disease, that scary, scary problem that everybody's so worried about.
Oh, yeah.
Cardiovascular disease is one of the leading causes of death in the USA.
Right.
Cardiovascular disease consists of things like a heart attack, high blood pressure, a stroke, hypercholesterolemia, atherosclerosis, arrhythmias, and maybe some heart valve issues as well.
Okay, Dr. Word.
Yeah. Hypercholesterolemia.
You're right, that one.
That just means you have an elevated level of cholesterol in your blood.
Thank you.
In conventional Western medicine, treatment of these conditions will include things like, medications, surgery, including bypass, insertion of stents, as well as valve replacements. And then you've got your pacemakers, and then you've also got defibrillation.
I think we all know folks who've had one or a number of these things.
That's right. That's
performed.
right.
Oof.
Now listen, if you're having an emergency situation, there is no better care anywhere in the world than what we have right here in the good old USA. Tremendous strides have been made in the care of acute cardiovascular situations. However, what about the prevention of these things?
All right.
How about the treatment of people who have early issues that don't require such a severe intervention? What does conventional Western medicine do about these things? Well, they do medication with some, usually dietary and exercise instructions. However, it seems that these serve only as a stopgap strategy. What happens is the patient still progresses and eventually ends up having some kind of cardiac or cardiovascular event. So my question is, are there ways to reverse these situations, to return the system to a more normal state? Well, I believe there are, and that's where functional medicine comes into play.
Let's step back for a minute, Doc. Cardiovascular disease is a major cause of disability and death, right? So how bad of a situation is this in our culture? What are the statistics? Do we have any of those?
Yeah, I sure do. Cardiovascular disease is the number one killer of men and women in the USA. According to the CDC, 610,000 people die from heart disease each year.
Wow.
375,000 of them die from coronary heart disease alone. 735,000 people have heart attacks. Of those, 525,000 are first-timers. That means that's the first time they've had a heart attack. The rest of the number are people who have had an additional heart attack. That is more than one.
200,000 more people a year have
additional heart attacks, right?
That's a lot.
I hope we are all familiar with the signs of a heart attack. Shortness of breath, the biggie, chest pain, pain radiating into the jaw or arm, and then this one, nausea. That's not uncommon in women. I don't know that men get that as much, but women definitely have a nausea component to it. And then there's that lightheadedness. Now, those are some of the major signs.
And Doc, do women experience most of these signs? Because we always hear, or we've been hearing lately, that there are different signs of a heart attack in women, some of the lesser known, and we're all kind of programmed to think of that chest pain, right arm.
Well, it is interesting to note that the number one sign of a heart attack in a woman is chest pain.
It is, okay.
Yes, it is. But, she'll tend to, the female will tend to have more of a nausea component, according to the statistics, than the man will. So that might be a kicker, for women. If they're experiencing some chest pain associated with nausea, that could be an indication that they're having some kind of cardiac event. Of course, it could be an indication, too, that they just got done eating a beef bean burrito and are having some issues with that.
I know. So easily explained away. That's the danger.
That's exactly right. I know there was a little bit of humor there, but that's exactly the point. Sometimes it can be something as simple as digestive upset, or it could be something as serious as a cardiac event.
Okay. So since we're talking about heart attack, as a public service announcement here, what should a person do who is having one, or a person who's with someone who may be having a heart attack or suspected of having a heart attack?
Immediately call 911. And if you're able to, take an aspirin. Now, some people may have already been prescribed medication by their medical physician, something such as nitroglycerin. So if you have that, you could certainly go and take that as well. Now, if you're with someone who's having a heart attack, and what if that person's unconscious, you might need to perform CPR. Now, here's a little bit of a trick and heads up for everybody. Everyone should take a CPR class and become certified. It's simple, and you may end up saving a life someday.
And where might you look to take a course in CPR, Doc?
I would think some of your community centers here locally would offer classes in that regard, or the Red Cross would certainly offer something along that line. I would think a simple way to find out would be to go to the internet and Google, where can I find a CPR class in my neighborhood?
Right.
And I'm sure you'll get all kinds of returns and results.
Right. Some churches also offer it. I know ours did.
Okay.
Or,
Alrighty, yes, but it's something everyone should do. Become certified so you know how to do CPR.
Thank you. And certainly there are risk factors in developing heart disease, right? I'm sure our listeners are familiar with them, but how about reminding us of what they are?
That's a great idea. The risk factors will include things like family history, being overweight, being diabetic, smoking, high blood pressure, hypercholesterolemia. And there are still, and it's interesting that they're still referring to this, but we'll talk more about that later. Then you have the risk of sedentary lifestyle. It's interesting to note that sedentary lifestyle, that is sitting at a desk all day, they say is almost the equivalent to smoking and creating heart disease.
Wow.
That's just a few of the risk factors, though, and everybody should be familiar with them.
Oh, that's right. I was about to ask you about hypercholesterolemia again, but you already defined that as high cholesterol.
That's right.
Okay, thank you. All right, let's move to another perspective relating to heart disease, if you would. How does a functional medicine practitioner approach heart disease? You think that is more of a specialty kind of thing. How much different is it than with conventional Western medicine?
Okay, to understand this, we need to have an understanding of how conventional Western medicine views the development of heart disease. The basic premise goes something like this. Cholesterol is elevated, as are the triglycerides, that is fat, and this creates atherosclerotic plaquing that results in narrowing of the arteries, resulting in heart disease, including heart attack. I know this is a bit simplistic, but it's essentially correct. Having said this, I must say that there are some types of fat that are bad for the body and can assist in the development of heart disease because they promote inflammation. However, inflammation is so much more a larger part than has until recently been ignored.
Really? Inflammation, okay.
Along with the risk factors that we mentioned a minute ago, the patient then can develop heart disease. We've all heard it. Reduce the fat in your diet because this leads to heart disease.
Right.
And if your cholesterol is elevated, take this drug, statins being the most common choice of the day. Now the question is, how did they arrive at this idea that hypercholesterolemia and fat and so forth is bad and it results in heart disease? Like we mentioned last week in our conversation about hypothyroidism, this came from research done by a guy named Ancel Keys. In 1948, he performed some research that led him to believe that a diet high in fat leads to cardiovascular disease. The research was met with quite a bit of resistance at the time, as many felt he doctored the data to support his findings. Even still, his findings became the standard and the accepted train of thought of the day. Things went so far that even the dietary recommendations made by the government for the public were changed. Carbohydrates became the substitute for fat. And if you think about it, and for those of you that are old enough to remember, carbs were the thing of the 70s. Remember, they started introducing things like reduced fat this and reduced fat that. Those things became the rage, and they still are today. You can walk down the aisles at Publix, and you'll see reduced fat salad dressings, for example. You can get reduced fat everything.
Yes, you can.
However, that became the problem. Instead of eating fat, people began to eat more carbs than ever. Even though the overall life expectancy has risen over the last century, heart disease is still the number one cause of death, with chronic disease increasing at an alarming rate. So why is this if the reduction of fat in the diet was the answer?
That's a good question. So if fat isn't the problem, then what is? I mean, that's all we've ever heard. Stop eating meat and butter. Saturated fat is bad for you. Carbs were the substitute, the pastas, whole grain breads, and potatoes. So what does one do?
Again, a great question. And it's my opinion that functional medicine comes from a different direction. Functional medicine physicians believe that heart disease is a direct result of, once again, chronic inflammation. And if we can control this chronic inflammation, then we can reduce the occurrence of chronic disease, including heart disease.
But how about heart disease specifically, Doc? How does chronic inflammation create heart disease? Like I said before, all we ever hear about is cholesterol, cholesterol, cholesterol.
That's another great point. One way chronic inflammation creates heart disease is by damaging the very thin lining of the arterial wall. Now, here's the question. Where does the chronic inflammation come from? Chronic inflammation comes from, most commonly, poor choices in our diet, specifically sugar. It's the sugar in our diet that creates that chronic inflammation in our body that results in this damage to the arterial wall that I'm going to talk about. And that's where carbs come into play, because carbs are sugar.
Right.
So even though we think we're eating the right things, we're eating carbs this and carbs that, and I'm not eating any fat. The problem is it's the carbs becoming sugar, and it's the sugar then that becomes the chronic inflammatory motivator, and that's what results in this damaging process to the wall of the arteries. Now, that thin layer of the wall of the artery is called the intima, just for you anatomy people out there. So when the products produced by that chronic inflammatory process within our body constantly barrage this thin lining, the thin lining becomes damaged. The body reacts to this damage by more inflammation, which eventually leads to a thickening of the artery at that spot. And when the thickening gets thick enough, it occludes or plugs up the artery. Trust me when I say that this explanation is pretty simple, but it does give the idea of what's going on.
Okay.
So instead of just worrying about cholesterol, if you remember a few minutes ago, I told you that we would talk more about this. Functional medicine practitioners look for markers of inflammation in the blood work. Markers such as C-reactive protein, homocysteine, and maybe ferritin. These are simple blood tests that can be run and give a good indication of the level of inflammation in the body. Certainly, the risk factors that functional medicine practitioners look for are basically the same as with the conventional Western medicine. Now, the exception to that may be high cholesterol. We may not worry so much about high cholesterol, but I think the biggest difference between functional medicine and conventional Western medicine is the treatment, or what we do about it. This is where the functional medicine practitioner would be separate from the conventional Western medicine practitioner.
I see. Okay.
Let's talk about medications real quick, just to let you know. I don't think any non-medical practitioner, that is one who's not a medical doctor, would tell a patient not to take medication given to them by their medical doctor. However, I do think there would be a discussion with the patient about their alternatives, with the suggestion that they discuss these things with their medical doctor.
All right, so now we know the patient has heart disease. How does the treatment differ for a functional medicine practitioner? What does he or she do or do differently that conventional Western medicine doesn't do for them?
I think the main differences arise in the treatment protocols. Like I said earlier, functional medicine practitioners deal with the why, not the what. You know, what? Well, we're having high cholesterol, we're having heart disease, we're having the heart attack. So let's deal with the what? Let's deal with the heart attack. Instead of dealing with why are we having the heart attack. I think that's a huge difference between the two, and results then in the treatment being different. The conventional Western medicine treatment protocol is primarily medicine, along with suggestions maybe of dietary changes and exercise. And if these things then don't work, they'll ask you for some surgery. You know, bypass, stents, and things along that line. I once again want to repeat that when it comes to acute heart issues, such as a heart attack, the only place the patient should go is the emergency room. The conventional Western medicine treatment is the best in the world for these acute situations. What I'm talking about here are the chronic situations. Patients who have had high blood pressure for years, or who have had a stent put in and now have no acute problems. These are the patients that I believe would respond very favorably to a more natural and alternative treatment plan. So what would be that plan? The plan would consist of evaluating and changing the dietary habits of the patient. Number one, having them on a more alkaline diet, for example. Eating the foods that would help reduce that chronic inflammatory process rather than enhancing it. The plan would also include nutraceuticals, specific vitamins, minerals, and herbs that are necessary for the body to heal the already damaged arterial wall.
And that's the definition of a nutraceutical, Doc, is vitamins and minerals and
That's
herbs.
right. That's right.
Okay.
Nutraceuticals versus pharmaceuticals. And we can discuss that here in just a second if you'd like.
Okay.
And finally, I think the functional medicine practitioner would include an exercise regimen designed to strengthen the body and improve the heart's function. Now, it's interesting to note here as a sidelight that there has been some research to suggest that vigorous, and I mean vigorous exercise, has actually been shown to reverse the damage of the arterial wall and restore its health. The last thing I'd like to say about this is that heart disease, like many chronic diseases, can be attributed to behavior. Many of the behaviors we partake in create the groundwork for chronic disease. What are these behaviors? How about the things we eat? Not exercising, or smoking, or not taking the time to relax and relieve stress. Just thinking about changing a few of these things can start the process of helping your body reduce the negativity of those behaviors. There are many conditions that can be well served by functional medicine. I hope you have enjoyed learning about a few of them, and as time goes on, we may discuss more of these topics on the Chiropractic Corner. Does every disease require medication? I think we can safely say that the answer to that question is no. And it's important for us to understand that there are natural alternatives that may in fact be better for us in the long run in maintaining our health and vitality.
Thanks, Doc. That was an interesting topic for this week. I hope our listeners have also learned something useful. And friends, if you think functional medicine might be an answer for your situation, we're here to help you. Remember, our address is 275 Tony Penna Drive, Suite 12, right here in Jupiter, and our telephone number is 746-4242. Thanks, Doc. I'm hopeful our listeners will take advantage of this new approach for their own benefit or for the benefit of a friend or a loved one.
Well, you're quite welcome.
Now for the tip of the week. Coenzyme Q10. I know we've heard lots about that here over the last few years. Your body makes CoQ10 and your cells use it to produce energy your body needs for cell growth and maintenance. It also functions as an antioxidant. And who among us doesn't want to hear the antioxidant word? We can't get enough of those. Research has shown that it helps heart failure, decreases high blood pressure, as well as some cancers, muscular dystrophy, and periodontal disease. It's also been shown to boost energy and speed recovery from exercise. Sign us up. As an example, one clinical study found that people who took daily CoQ10 supplements within 3 days of a heart attack were less likely to have subsequent heart attacks and chest pain. They were also less likely to die of heart disease than those who did not take the supplements. Anyone who's had a heart attack should talk with their functional medicine provider before taking any herbs or supplements, including CoQ10. So remember, Coenzyme Q10 for the health of your heart and the improvement of energy and stamina. If you have any questions about the vitamins or supplements you take or think you should take, drop us an email at iamchiro1@gmail.com. And remember, our phone number is 746-4242.
And if I can just jump in real quick here, Laura.
Sure.
I'd like to remind our listeners of our website, www.jupiterflchiropractors.com. Please feel free to visit our website and listen to the archives of the Chiropractic Corner, as well as other interesting information you might find about health and disease.
Well, that about wraps it up for another edition of the Chiropractic Corner. Again, thank you for joining us and for all of your input. Dr. Volstad and I would like to thank you for listening, and don't forget to let us know what questions you may have for Doc or topics you'd like to learn more about by emailing us at M as in Mary, CHIRO, the number 1, @gmail.com. We're located at 275 Tony Penna Drive, Suite 12, right here in Jupiter. And our telephone number is 746-4242. We'd love to hear from you. Google Volstad Chiropractic to find our website for more information about our office or to listen to archived programs from the Chiropractic Corner. For those on Facebook, please search and find our Facebook page and give us a like. We post a lot of information about healthcare and natural remedies that you can use at home. Join us next weekend for another edition of the Chiropractic Corner, right here on WJUP, The Jupe, 103.9 FM, Friday morning at 9 a.m. right after the Dick Farrell Live Show, and again Saturday morning right after the 10 a.m. news. Until then, be well, live well. We'll see you next week.